Welcome back. My next guest is Dr. Frank Rutigliano. Now I'm going to try to get this right, with colorectal and gastroenterology associates. Is that right?
Colorectal surgical and gastroenterology associates.
CSGA for short.
Yes, sir.
All right.
That's right.
Now this month is Colorectal Cancer Awareness Month. So that's what you do. So what's the big deal?
So colorectal cancer still persists to be the third leading diagnosis of any cancer-related disease within the United States. Interestingly enough, Kentucky has the second highest rate of colorectal cancer within the United States. So it is a problem that affects everyone. Roughly 1 in 25 men or 1 in 23 men or 1 in 25 women will be diagnosed with colorectal cancer.
So why Kentucky? Is there something here that makes it more prominent?
So there's certainly things that can influence development of colon and rectal cancer. There's some modifiable risk factors, so things like obesity, a sedentary lifestyle, meats that are processed or red meat diet can increase those risks of colon and rectal cancer. There's also other things that we can't influence, such as genetics and inherited diseases that increase our risk of colon and rectal cancer.
Does smoking, alcohol have an effect?
Absolutely. So smoking increases your risk of colon and rectal cancer, and excess alcohol can as well.
Okay. Now you mentioned risk factors, family risk factors. So let's say you've got one. What do you do?
Great question. So at first, the national recommendations for screening colonoscopies start at age 45. And if you have a first-degree relative that also was diagnosed with colon or rectal cancer, those screening guidelines drop down to age 40, and in fact 10 years prior to the earliest onset of their cancer. So if your father was diagnosed at age 42, you need to start a colonoscopy at age 32.
So are there symptoms that would think, well, you probably ought to get screened anyway, but are there symptoms of colon cancer that even make you think more so?
Sure. So I think one common misconception is that red blood on the toilet paper is always attributed to hemorrhoids. While certainly that makes up a large quantity of those patients, any bleeding should be evaluated by a healthcare provider. More worrisome features include change in bowel habits or change in the caliber of your stool. If you used to have more formed stools and now they're pencil thin, these are warning signs to us that you need to come and get screened.
Now, other than we talked about risk factors, are there things you can do to prevent colon cancer?
Right, absolutely. So, in fact, over the last 30 years, we've seen benefits from screening colonoscopies. So, our trends nationally have shown a decrease in colon and rectal cancer, especially in our elderly population, and we believe this to be from colonoscopies. During a colonoscopy, your physician is trying to identify polyps that may develop into colon and rectal cancer. So by removing them, we can prevent that development.
So you can actually you can diagnose and treat with one simple test.
All at the same time.
Now, go over one more time the screening methods again, because they've changed. From 50 down to 45 is the big change.
That's correct. So the biggest thing about that is we have noticed that over the last 10 to 15 years, while the overall rate of colon cancer is decreasing in our elderly population, the rates of colon and rectal cancer in patients under the age of 55 is increasing, roughly at 1% to 2% per year. So in the last 3 to 4 years, our national guidelines dropped down from age 50, which was the standard for many years, down to age 45.
Okay, one last question before you leave here. I always ask this every year because we have this segment, the prep. That's what everybody complains about. They hate the prep. Has it gotten any easier, or is it just what we got to do to save a life?
I would say the prep has gotten easier. That's certainly the biggest complaint that we have. I think a colonoscopy, for the most part, is pretty smooth, and the worst part is the prep. Things have changed a lot over the last 15 years, so you don't necessarily need to drink a gallon of laxative in order to clean you out. We now have smaller volume laxatives or even pills that you can drink with water in order to clean you out.
All right. We appreciate what you do, and we appreciate the screening methods that you do. And if you haven't had your colonoscopy, make sure you're up to date. We'll be right back.